Hello and welcome to Nurse Leadership Module. This presentation focuses mainly on key skills and competencies necessary for nurses to develop to be able to function as effective leaders. According to Grossman and Valiga, nursing leadership is a competency that all nurses need to acquire and continue to improve just as they do with their practice expertise. Regardless of the work position a nurse holds, may she be a staff nurse, charge nurse, manager, director, or educator, each one is to dismiss the idea of considering self as being just a nurse, rather is expected to provide leadership in any given situation. That said, nurses must be able to develop the skills and competencies that would enable them to positively impact patient care experience. Such skills and competencies of nurse leader are as follows. Motivation and team building skills. A nurse leader must possess the ability to motivate and promote teamwork among the staff nurses and other healthcare team members. Nurse leaders have a significant role in fostering healthy work climate through facilitating practices that would influence peers to take pride and feel ownership of what they do. Building a foundation for safety culture begins with high-quality training of employees and continues on with fostering cohesive interdisciplinary collaboration to effectively enhance both employee and patient satisfaction. A nurse leader must be able to create a motivating climate for the team, establish organizational communication, manage conflict, facilitate collaboration, engage in negotiation, and comply with organizational rules and regulations. Effective communication. Effective communication is a vital component of creating culture of safety within the organization. Accurate reporting on patient care updates is highly expected of nurse leaders, between nurses and physicians, with other healthcare team workers, and with patients and patients' family members as well. To become effective communicator, the nurse leader must be able to send clear message to the team, listen actively to the message being conveyed, monitor responses, provide feedback, and determine what receivers see and hear. Collaboration skills. Collaboration is an integral component of quality healthcare. As frequently defined, interdisciplinary collaboration is a process of interaction between two or more disciplines for which shared knowledge and ideas are studied or analyzed with the intention of coming up with the most reasonable and logical solution to a problem. A nurse leader must be able to create a supportive environment, develop a sense of success and establishment of an esprit de corps and interprofessional cohesiveness, and place value and understanding on the unique contributions of the other discipline's role. The process of collaboration usually results in a discovery of mutual goals with the patient's well-being as the primary focus. Critical thinking and problem-solving skills. According to Zacho Smith, nurse leaders who desire to succeed in times of trying changes find creative thinking and problem-solving abilities essential tools in achieving goals. Critical thinking and problem-solving is a major attribute in the field of nursing as it helps the nurse leader in fulfilling their role effectively and efficiently. Critical thinking involves taking into consideration several details related to the situation in order to properly evaluate, analyze the case, and consequently come up with a sound logical judgment. A nurse leader examines assumptions, interprets and evaluates arguments, envisions and explores alternatives, develops reflective criticism to achieve logical decision, and she is expected to base her decisions on evidence. Effective delegation and evaluation skills. Another important component of creating safety culture is the nurse's ability to delegate. According to Waite, delegation is a skill that maximizes the available resources in the interest of patient care. This could entail having in-depth understanding of patients' needs and available resources in order to facilitate nurse-patient matching. An effective delegator must be able to understand what patients and families need, engage the appropriate caregivers in the plan of care, maximize the available resources on the patient's behalf, and be able to evaluate the outcome of patient care in order to make improvements when necessary. Visionary. To have a vision is to have a foresight of where, when, and what a nurse leader aspires to achieve for the team. That said, the nurse leader must be able to trigger inspiration among the team by conveying passion for the vision, rallying people around it, and striving to get the team to commit to the achievement of it. A nurse leader is future-oriented, insightful, strategic, shares dreams and visions to team members, and owns great perception of wisdom. Those are the key skills and competencies expected of a nurse leader. Apparently, the core foundation of healthcare practice and systems, including its characteristics, are vividly evolving in front of our very eyes. Come 21st century, nurse leaders will be facing many challenges as the patterns of healthcare delivery become more complicated across nursing practice. The increasing complexity in clinical practice, attributed to the increasing demand for more improved delivery of quality care, as well as the high-speed emergence of system innovations, may cause pressure buildup among nurse leaders, especially if not equipped with the skills and competencies necessary to stand up for the role effectively. A nurse leader emerges into the role and take charge by leading the workforce in employing quality and safe nursing practice. Thank you for watching.